Hello, 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 everyone, and welcome to the Heart of Innovation. Dr. John Phillips, my amazing co host, is taking this one off because we are talking about women and hormones and cardiovascular disease. So, that trifecta, I don't think he belongs in that conversation. And especially since we actually have one of his patients who is our amazing nurse practitioner, Deidre Arms, who is here to talk about all of that. She specializes in that topic, and we're going to get to that in just a few moments. But welcome, nurse practitioner Deidre. Thank you for co-hosting slash being a guest on the show today.
Thank you for having me. And I will say, Dr. Phillips does know some stuff about estrogen replacement. We've had this conversation.
Have you really?
Yes, he's a zebra in his field for being able to be open to things and having that discussion.
Goodness, I would love to hear more. But before we get into this discussion, I think it's time for a moment of inspiration in honor of Dr. John Phillips. Okay, so our producer, Joshua, has found a quote from Eleanor Roosevelt. The future belongs to those who believe in the beauty of their dreams. That's a great quote. What are your dreams, nurse practitioner Deidre?
I would say my dream is to impact as many women as possible in this space of cardiovascular, HRT. Yeah, I just have a passion for people. So that's a dream of mine to just continue this path.
I love it. I love it. Oh, what Josh says in the chat, how about opening a retreat center since you attend a lot of retreats? Why not just start your own?
Yeah, Josh, you called me out on that one. I do like to attend a lot of retreats, and maybe in the future, like I guess the options are endless, right? We don't know our full potential until we really are diving into it and chasing it.
And I think we're aligned on our dreams. I just want to help people. That's all I care about. My purpose in life is literally to serve others and to help them live the best life possible. And through the Global PAD Association, which is my organization, which I feel so blessed to have you as a critical advisor on, especially when it comes to nutrition and supplements and now hormone therapy and cardiovascular disease. Um, I really want to save life and limb. And Global PAD Association, we support patients with peripheral artery disease. If you have logged into any of our shows prior to this, you know that peripheral artery disease is more prevalent and deadlier than most cancers combined. Breast cancer, colon cancer, prostate cancer, the numbers don't even come close to peripheral artery disease, which is that poor circulation in mainly the leg arteries. But 3 in 5 people who suffer a heart attack have peripheral artery disease. So, 2 fingers, 2 seconds for a doctor to feel your leg and foot pulses, that could save not only your limb, but also your life. And that brings us to the topic of the day. There are so many patients in my group that are asking about the connection between menopause, hormonal issues, and cardiovascular disease. And so I really appreciate your expertise on it as we move forward. I know the Mayo Clinic appreciates your expertise. You were just presenting at the Mayo Clinic.
Yes, we did a poster presentation. We were chosen for that. It was a case study I did, and it was on the gut microbiome, but it also was a woman's health topic, polycystic ovarian syndrome. And so, looking at those women who really struggle with infertility and menstrual cycle irregularities. And so, it was a great conference, and it was warm in Florida. You know, I'm here in the cold, so.
Good. So maybe your next one over at the Mayo Clinic is going to be on hormone therapy. Where should we begin with this conversation? I think, what is that connection between? Is there a connection? Is there any evidence that shows some sort of connection between hormonal issues in women, and cardiovascular risk.
Absolutely. So hormones like estrogen and progesterone, they really play a role in our vascular function, inflammation, and our lipid metabolism. So when estrogen declines during menopause or after a hysterectomy for some women, the arteries become stiff, right? So you get that arterial stiffness that increases. That's when we see often blood pressure rises and inflammation worsens, all of which raise our risk for cardiovascular disease. Have you ever noticed, though, how women's heart disease risk jumps after menopause, right? It's not before, and that's because estrogen was offering a protection that suddenly disappears. So, if you're a woman over 40 and you start to notice changes like high blood pressure, cholesterol shifts, or unexplained fatigue, these can be early signs of cardiovascular changes related to hormone shifts.
And I'm just going to be frank about this. It actually sucks to think that it's just inherent to the nature of being a woman that we do have an increased risk just because of who we are and the process by which our body goes through as we age.
It's so true. Yeah. Yeah.
So, you mentioned BHRT? We want to get into what that is. How does bioidentical hormone replacement therapy, or as you call it, BHRT, impact heart health in women?
Well, so BHRT, when it's initiated correctly and tailored to the patient, really can support vascular health. It can reduce inflammation and it can improve lipid profiles. So when we look at the studies on transdermal estrogen, and that's a topical, right? It can be in the form of a patch, a cream, a spray. Those transdermal estrogens can lower coronary artery calcifications and improve the endothelial function. So it means that you have less arterial plaque buildup and better circulation, which are key factors in heart prevention. You may have been told that hormone therapy is dangerous for the heart. And so that's why we're having this conversation, just so we can talk a little bit about um, really that it's not and what the recent studies are showing.
So, what exactly is BHRT? Before we get into those misconceptions, what exactly is it?
So it's bioidentical hormone replacement therapy, and basically the molecule of the estrogen progesterone for bioidentical is identical to the molecule that our body naturally produces. So it's very different than the conjugated equine estrogens that are synthetic. Obviously, there's always a synthetic component because we're making it, exogenous and not inside of our own body. But bioidentical is that molecule is identical to the molecule our body naturally makes.
And coming up right here on the Heart of Innovation, we'll have more with nurse practitioner Deidre Arms talking about the misconceptions about hormone therapy and cardiovascular risk. So stay with us. Don't go away. You're listening to KDOW. Okay. So those who are watching online on our YouTube channels, both at NP Deidre and also at The Way to My Heart, we are live taping our radio show that is going to air on KDOW on Saturday, March 8th. And so you're listening, you get the whole behind the scenes of this recording that will be live um, on March 8th. 2 p.m. to 3 p.m. Eastern Time, KDOW. It's also going to be available after that on iHeartRadio, Spotify, Apple, Google, all of the above. It's everywhere. So make sure to listen up for that. Deidre, how did we do in the first segment? Did we do well?
I thought so. Yeah, we got to add a little
Okay.
bit in there. Those are great questions that you have. So always so.
Yay. Okay. So we're going to just start off. We're going to go into, let's do a little quick recap on BHRT and then let's get into the misconceptions.
Okay. Yeah.
Okay.
I
Here we go. Well, go ahead.
I was just going to say, I think it's important to let people understand that the risk for cardiovascular is the number one leading cause of death in women, like hands down. So
Okay.
the worry of breast cancer is very minimal compared to that risk.
Okay. We'll start there and then we'll move into the misconceptions. We'll start there, go into again, BHRT. Is this something that's new? Is it why are we hearing so much about it now? Is it something that's standard? And then go into misconceptions.
Okay.
Okay. Here we go. Joshua, our producer, thank you so much. We are ready in three, two. Hi, everyone, and welcome back to the Heart of Innovation. Dr. John Phillips is taking this show off because it's just all about women. Although, as nurse practitioner Deidre says, she's one of his patients, that he is very open to these types of conversations. And she has, in fact, had this type of conversation with him before about estrogen and cardiovascular risk. And so before the break, we did get into a little bit. Let's recap for those who may just be tuning in right now on hormones and menopause and cardiovascular risk, because cardiovascular risk, you were just talking about during the break, is literally higher than breast cancer. So we're all worried about breast cancer, but we should equally, or if not more, be worried about our heart as well.
Agreed. Like we need to be thinking about how to protect our hearts. Like what can we do to optimize our health? Because as you see, women have more risk of heart disease as we lose estrogen. And that was something we talked about a little bit. So loss of estrogen in menopause or even surgically increases our risk for cardiovascular disease.
And one of the new hottest trends is what's called BHRT to help reduce our cardiovascular risk. I know, again, we talked a little bit about that in section one, but let's just give a recap of what is BHRT and why is it the hottest trend right now? Why is it the go-to?
So I would say it's the hottest trend for the simple fact that women have a voice and we're starting to stand up and say, like, what are the studies, show me like how I can optimize my health. Bioidentical hormones are hormones that are the molecules very like identical to the molecule we actually have in our body of estradiol and progesterone. I want to like also make you aware or talk about that with bioidentical hormones. This isn't a new thing. There are many FDA approved bioidentical hormones. So I think sometimes people think it's only a compounded medication, but that's not true. There are many forms of bioidentical hormones that are FDA approved and prescriptions.
And I want to get into a little bit more on BHRT, but first, I know that there are probably quite a few patients that are saying, whoa, but wait a minute. I heard that hormone therapy can increase my cardiovascular risk, but you say most of them are myths, that this type of hormone therapy, or is it just this type of hormone therapy that maybe is the exception to the
And, and so that good questions, great questions. And the biggest myth that we're all kind of dealing with is that all hormone therapy is dangerous for the heart, right? And this belief actually stems largely from a Women's Health Initiative study, which that was 20 some years ago. And we went from like 50 million women being on BHRT to maybe 5 million at this point. And it's because in that study, they used synthetic progestins and oral estrogen in older women, right? So a combination that increased clotting risk. The newer research, though, shows that bioidentical hormones and the right route of administration actually protects cardiovascular health. I mean, Are you aware that that WHI study was reevaluated and the newer research supports the benefits of BHRT? Like it's it's
I always
really
wonder, in those, what was in that first study versus the second study, how were they conducted differently? That one says, okay, not good, and the other one, the newer one, says, okay, good.
right. And so that study, it was flawed. When we really look at it, that could be an entire episode on how flawed it was. And then the media caught wind of it, and it becomes something that really scared women, and providers to even prescribe hormone therapy for women in menopause.
I think it's important to note that there is a difference. So when you're talking about hormone, wow, that is one of those words, hormone therapy. There is a difference between, and you mentioned this, the bioidentical versus synthetic. And I really want to drive home that point.
Right. The bioidentical hormones mimic the body's natural structure, where the synthetics, like the medroxyprogesterone, those increase your risk of clots. And that's why you're going to have a conversation with somebody and they're going to say, well, that increases your risk of clots, but it actually has to do with what type of hormone. Bioidentical does not increase the risk of clots. The synthetic does. It increases clot risk, inflammation, and arterial stiffness. There was a KEEPS trial, and other research confirms that bioidentical progesterone does not have any harmful effects. And so that would be what is known as micronized progesterone. And it's an oral, you take it orally. It's actually a calming hormone, your progesterone is. So it helps promote sleep, calmness, mood, lots of benefits outside of cardiovascular.
But really, the key here is that estrogen does play a very important role in vascular and heart health.
Yeah, estrogen's a powerhouse for the heart, right? It boosts your nitric oxide production, and that promotes vasodilations, giving you wider arteries, better circulation. It reduces inflammation, so it lowers the oxidative stress and plaque buildup. And it regulates your lipid metabolism. So it can increase the HDL, which is your good cholesterol. It can lower the LDL, the bad cholesterol. And so if you could take a supplement that improves circulation, reduced inflammation, and lowered cholesterol, would you take it? Well, estrogen
Yes.
does. Estrogen
I
does
mean,
that all
depending on the
naturally.
side effects.
Yeah, and estrogen does that all naturally.
So here's where I might be a little confused. So you have estrogen and then you have progesterone.
Yes.
Okay. So this bioidentical hormone replacement therapy, this BHRT, is it both or is it estrogen or progesterone? Is it I'm a little confused.
So that's a great question. So we usually do both because they're like brick and mortar to each other. If you have a uterus, you do not want to take estrogen alone because it can build up the endometrial lining in the uterus, causing risk there. So we want to take them together, estrogen and progesterone. So bioidentical estradiol and bioidentical micronized progesterone together. And that's how we, decrease any risk of the endometrium within the uterus, and it's how we promote cardiovascular health as we go through menopause.
And coming up right here on the Heart of Innovation, what I'm learning is there is a window of opportunity for women to actually take these drugs in order to reduce their cardiovascular risk. We're going to find out what that is next, right here on the Heart of Innovation on KDOW. Don't go away. Thank you for not making me feel stupid. I got a little confused. So I want to ask you about, so with those, are they two different pills? Like, what does this look like?
So I never recommend oral estradiol because that does increase your risk of clotting, even if it's bioidentical. There is one brand that's bioidentical. the topical, the transdermal, like even in the studies where somebody has had a clot before, we know that the topicals are safe to use. And it's an individualized approach. So you do either a patch that you change twice a week, or they do a spray or cream daily. And then the progesterone, the micronized, is taken at bedtime, and it's a
Got,
pill.
so you're gonna repeat all of that. So
Yeah,
those who are watching on YouTube right now at NP Deidre and also on the Way to My Heart's YouTube channels right now or on Facebook, we are doing a live recording for our radio program on KDOW. So this is considered a commercial break where we can talk about what we're going to talk about and talk about what we talked about. So you're getting the behind the scenes. And in case it was confusing then and you need it repeated, the information she just shared, guess what? She is going to repeat that again as we go into segment 3 for the Heart of Innovation. Okay,
perfect.
this is great. Ready? Josh, our amazing producer, is here. He's timing it. We are going into segment 3 in 3, 2. Hi, everyone, and welcome back to the Heart of Innovation. We have nurse practitioner Deidre here talking about hormone therapy and just basically hormones and cardiovascular risk. Before the break, we talked about there is a difference between estrogen and progesterone, but they can all fit into this BHRT therapy. And during the break, you were explaining that there is a difference between these two. And I'm curious, how are they administered? And how do you have that conversation with your doctor to make sure you're not just getting estrogen, but you're also getting the progesterone, which you say is key for anyone that has a uterus?
Exactly. So you really want to be talking to somebody who understands BHRT and hormone replacement. I want to preface that first. And there's different delivery routes. So there is a bioidentical oral, but that does, any oral, because we have to go through the liver and everything, it can increase your risk of clots. So when we talk about bioidentical in this space today, what I'm referring to is the topicals. So that could be a patch that's worn. There's a FDA approved patches, there's FDA approved sprays, there's FDA approved creams and various forms. So that's your estrogen component of things. You want that to be topical because you want to bypass the liver metabolism, and that decreases your risk of clots. It's also been studied and known to be safe for people who have a history of clots, but that's an individualized approach. And then the progesterone, micronized progesterone, is actually a capsule that you would take at bedtime because it promotes sleepiness. It's kind of the side effect to it. It's your calming hormone. And we take those together because they're brick and mortar for the endometrium, which is the lining of the uterus. So.
Oh, goodness. As we age, we have trouble sleeping, and anything that will help. That is amazing. How do the two work together, though? I mean, if you're taking them separately and in two different ways, do they automatically just meet in between inside you?
Well, they work together because you're taking them, the patches or the creams, like that. When you wear a patch, you're typically wearing it for about 3 or 4 days. So you're getting that continual dosage of the medication. If you're doing a
Okay.
cream, it's 24 hours. And then, so it's the half-life of the drugs. And so they're both in your system and they're working together.
So I know that sounded kind of like a weird question, but people don't understand sometimes when you're taking these pills, the mechanism of action by which they work, and they're all kind of meeting there in the blood and doing what they need to do.
Yes, they are.
And so, are there any specific routes of hormone administration that are safer for cardiovascular health? In particular, you talked about definitely doing things transdermally for the estrogen, but does that automatically kind of translate into something that is safer for your cardiovascular health versus other methods?
Right. It's safer because you are bypassing liver metabolism and have less of a risk for clotting, right? Oral estrogen does increase that clotting factor, so making it less ideal for women who are at risk for heart disease. Um, and so I always say patches, gels, creams, those are what you want if you have a history of cardiovascular disease or are at high risk for heart disease.
So can you explain then? I'm almost afraid to hear this, but and I know many might be because we're worried about, well, are we too old? Are we too young? Did we miss the window of opportunity to be able to take have BHRT therapy and have it make a difference? So, talk about that window of opportunity for initiating BHRT to protect heart health.
Yes, so the window of opportunity refers to starting BHRT within 10 years of menopause to gain the most cardiovascular benefits. It doesn't mean that you cannot take HRT after that 10-year window. It really means, and in the ELITE trial, it showed that estrogen therapy started early improved our arterial flexibility and reduces heart disease risk. But starting it too late might not have those same benefits on the heart. So you want to really consider starting this early in that window of opportunity to get the most benefits for your cardiovascular system. Because think of it, once disease has started in those arteries, we can't reverse that by giving bioidentical hormones. But what we can do is prevent it. So you're thinking of it as a prevention for that.
So you mentioned, I want to drive this home. I think it's so interesting that BHRT, there's evidence to show that it actually reduces inflammation and increases arterial flexibility.
Yes, yes. So
Wow. And especially with that flexibility in the arteries, that's really key when you do have some atherosclerosis, that there is that flexibility in the arteries. You don't want stiff arteries.
no, we don't, right? You want to have the flexibility. And that's why we see so many people after menopause start to have an increase of cardiovascular disease because we get that arterial stiffness, right? And we have inflammation. So hormones, estrogen plays a really important role in our cardiovascular.
And here's another one that I think a lot of people won't like me asking, but I am going to ask because we talk about lifestyle modifications as critical to reducing cardiovascular risk. So, how do lifestyle factors actually complement hormone therapy in protecting heart health?
Right. That is an awesome question. And I want to say, like, while bioidentical hormones is a great tool, it is not the only thing you should be doing, right? It doesn't outweigh all those great lifestyle risks or lifestyle changes that you do. So eating a heart healthy diet, exercising, getting in enough fiber, like all of those really important key things, working on your stress management and everything, and then optimizing your hormones. That's going to give you the most value for lifestyle and medication. Like you integrate the two so that you live your most optimal life.
Coming up right here on the Heart of Innovation, we'll have more with nurse practitioner Deidre on hormone therapy and reducing your cardiovascular risk. You don't want to miss what's next because she is going to give you the questions to ask your doctor to determine if BHRT therapy is right for you. So stay with us right here on the Heart of Innovation on KDOW. Don't go away. Yay! Nice job.
Thanks.
Um, so this is our last big segment, and then then we'll have a 4-minute segment where I'm just going to have you give us the key takeaways.
Okay.
Um, I don't know if Marie has any questions or if anyone online has any questions that we can get to. We have quite a few people watching online, so I want to let them know that we are here and we are taking questions. So if you do have them, I just want to double check online really quick to see if anything is coming in. And we do. Oh, we have Patty here, and we do have Karen here with Aortic Hope. Hi, Karen. Hey, Patty. So Karen does have a question that we're going to get. She says she was told that BHRT is not safe for those who have had a TIA or mini stroke. So is that something that you can address in the next segment?
Yeah, it's especially if they're taking an oral BHRT, and it's not a one size fits all. So that's why I say you want to talk to somebody specialized. There's ways to, yeah, I can talk about it. There's ways to assess your risk after you've been treated to know, like, would you benefit from this?
Fantastic. Okay, so we're going to come back. We're going to go, should we go right into section 4 is 8 minutes. Section 5 is 4 minutes. So I just want to make sure. Sorry, Josh. We have 5 segments for the actual Heart of Innovation. And I do want to get to Karen's question. We do have I have just a few other questions that I wanted to ask in particular on
Okay.
this as well, but we're going to get to this. I wanted to reiterate just the importance of, lifestyle modifications, walking and eating right. I mean, all of those things do play a role in helping to balance out everything in your system. So this isn't a replacement for it. So we'll go
Right.
and start there.
That'd be good. Yeah, because we really want to say that. Like, while this is great, those are so, so important.
Yep. Okay. Here we go. In 3, 2. Hi, everyone. Welcome back to the Heart of Innovation. We're with nurse practitioner Deidre. This entire episode is dedicated to women or the women that you love who are in your life and maybe at that point where they've experienced menopause and or they are high risk for cardiovascular disease or have cardiovascular disease or a vascular disease. We're talking about hormone therapy and whether or not it's right for you or someone you love. But before the break, I think nurse practitioner Deidre, you brought up a really good point about how hormone replacement is not going to be the end all be all for you, that you still have to focus on those lifestyle modifications, diet, exercise, and smoking cessation.
Exactly. It's one tool. BHRT is one tool in your cardiovascular protection. But diet, exercise, stress management, can't say enough about that, and sleep play major roles. We know that the Mediterranean diet has been really well studied. And so a style of diet like that, doing some resistant training, mindful practices, those all enhance hormone balance and heart health. So, if you want to balance hormones, you still have to do those lifestyle factors as well. And then BHRT can be a tool in your cardiovascular protection.
So we're getting at a question from the incredible CEO of Aortic Hope, and she is asking about being told that BHRT is not safe for those who have had a TIA or a mini stroke. What are your thoughts?
So, for women with active cardiovascular disease, hormone therapy requires really careful evaluation, right? Oral estrogen, especially, may not be suitable, but transdermal with bioidentical progesterone can often be considered. And there's some risk evaluations that we would want to consider. We would want those patients to be stable. So I'm not saying it's a no, an absolute no out the door. If you're speaking with a provider and they instantly say no, kind of ask them, like, why? What's your reason behind it? And show me the studies and how that relates to me, because they may have outdated thinking based on that WHI study. And there may be better things. So working with somebody who understands that and can have that conversation with you.
And you did mention earlier on, and you just reiterated again, that there is new evidence. And if patients are going to talk to their provider, it might be worth their time to gather up some of that evidence and bring it with them. So, can you give us a few that they can Dr. Google to have on their phone and ready to present to their doctor when they have that consult?
Yeah, so there's lots of them out there, but the ones that the meta-analysis that is all the hype is the ELITE trial. So it showed that starting estrogen early benefited the heart. The KEEPS trial showed bioidentical progesterone is safe for the heart. And then there was a Danish osteoporosis prevention study that found lower heart disease with early estrogen use. So, looking at the newer studies, they even reevaluated the WHI study. So, looking at the reevaluation of that and what that really means, that's a key thing here. We talked about that initial WHI study scaring everyone. There was this media hype about it, but nobody has talked about the reevaluation and what that really meant.
But I don't want people to walk away thinking that BHRT is the holy grail. There are risks involved with any hormone therapy, correct?
There are minimal risk with bioidentical and transdermal versus oral. So you really want to have that conversation to know if you're a good candidate for it, right?
So how do you know if you're a good candidate for BHRT? What is that conversation that you need to have and the questions that you need to ask your doctor?
Yeah. So first of all, you want to speak to a provider who can talk about menopause, right? You want to be in menopause and having symptoms of menopause. We don't start BHRT just based on your cardiovascular risk. You have to be having some sort of menopausal symptom. And then we do a cardiovascular risk assessment to see, are you even a candidate? And that's looking at your lipid profile. And like we calculate out what your risk for a heart attack is in the next 10 years. We look at your personal and family history. What are your inflammatory markers right now? And we also test your hormones. So I always say, look at those levels of hormones, know what's going on in your body. Really asking, are you a candidate based on your personalized risk factors? And looking at what your hormone levels are.
So what type of doctor are we looking at? Or is this something that people are going to have to pay cash for a consult to see a nurse practitioner like yourself that specializes in it? Is this something that you can talk to your gynecologist about? How do you know, even if your gynecologist has the knowledge necessary to be able to prescribe this properly for you? And then I've got another one for you, so I don't forget. At what point do you involve your cardiologist or your vascular surgeon into that conversation, especially if you're on uh, other medications such as blood thinners or statins?
Right. So your cardiologist, you should be able to have that open conversation and really talk to them about your risk benefits. I have a personal history, as you said, and Dr. Phillips and I did talk about like hormone therapy. And as a cardiologist, he's seen the biggest risk with people who took oral estrogen versus a transdermal. So that was a conversation that we had. And so you really want to assess your personal risk, where you are on this journey. And you're right, we can't just assume that our OBGYN is somebody who can prescribe these and actually does this for you. But there are organizations like NAMS, which is North American Menopausal Society, that have providers that are NAMS trained. BHRT Academy has providers that are trained in BHRT. So there's many ways to look into these organizations that train specifically for bioidentical hormones and hormone therapy, menopause in women. And that's where you can kind of look in your area and find that provider for you. And no, not everybody is cash pay. There are many providers that I know that are in a traditional model. So makes that
And coming
available.
up right here on the Heart of Innovation, we're going to find out if insurance covers BHRT therapy and any limitations that might be there as well. So stay with us right here on the Heart of Innovation on KDOW. Don't go away. Good little teaser there. Final 4 minutes. Um, so it would be interesting I'll ask you if insurance covers the actual BHRT therapy, what are the limitations? Also, compounding versus the other FDA drugs. Compounding is really a big deal these days, and wondering if that's an issue. And then just any, critical questions, just if you have just a few questions that are critical to ask any doctor before taking, this type
Okay.
of therapy, to ensure that you're not just doing it because it's cool. You really want to make sure it's right. Okay.
Yeah.
Here we go. Josh, we are all set for segment 5. Thank you again for doing this. And a big thank you to all who are tuning in right now. I want to give a shout out to Priscilla and Teresa and Patty and Laura, and of course, Karen, my favorite CEO of Aortic Hope. And Amanda's there, Judy's there. Oh, we even have a wonderful gentleman. Peter is watching as well, hoping to maybe help some lovely women in his life. So, really important conversation that we are having here, and a big thank you to Douglas for joining in as well, so he can help other ladies in our network be pointed to this incredible video if they do have questions about this. I know that this conversation on this started with a couple of friends in the group, Kathy and Felicia. So a big shout out to them for bringing it to my attention, and to nurse practitioner Deidre, of course, for being here and answering our pleas for help on this topic, and for being here and being so flexible today. Okay. So with that being said, subscribe. Just kidding. I'm really not, but that just sounded like it would be fun to say. Segment 5. Are we ready? In 3, 2. Hi, everyone. Welcome back to the Heart of Innovation, a very important topic today dedicated towards women and cardiovascular risk, and how hormone therapy may, in fact, help. Before the break, we were talking about these consults for hormone therapy being covered by insurance. But nurse practitioner Deidre, is hormone therapy, is BHRT covered by insurance, or most insurance? Anything we should know about that?
So it actually is. So the transdermal patches, they're actually really inexpensive. You would be surprised. Like for many people, the micronized progesterone is dollars on a month's worth. It's very affordable with insurance. Where we get into it being a little more costly is name branded bioidentical hormone stuff, but that's with any name brand, as you know, in this cardiovascular world, that can be a struggle. But there's many generic forms of bioidentical hormones that are covered and reasonably covered for women.
Is compounding an option?
So compounding is an option. All compounding pharmacies, though, they do not accept insurance, so there's cash pay prices for that. I will say, though, many of them are affordable. For compounding, you're looking at anywhere from $40 to $100 a month. So that's something to look into if we're on a budget, is to make sure that it's right for us. Not only is the bioidentical hormone right for us, but the cost of that as well.
And our good friend Marcia is writing in with a question. She's wondering how this therapy might benefit someone who has had a total hysterectomy.
So with a total hysterectomy, it's abrupt, like menopause. And so it can be very beneficial for women, because once we lose our estrogen, whether it be through menopause or surgically induced menopause, we start to see risk of cardiovascular disease increase after that 10-year period. So starting it early after a hysterectomy, and even if low dose, giving the benefit of the hormone. There's a lot of studies that support, even if you've had taken bioidentical hormones for a short time, you get long-term effects on the cardiovascular system. So you don't always have to take it, the longevity of your life or anything, but even just a short window of that can help improve the cardiovascular.
In our last 30 seconds here, what are some critical questions that women should be asking their doctor prior to starting hormone therapy?
Are you a candidate for bioidentical hormones, right? What factors determine whether it's safe for you or beneficial? Ask them about the current studies and everything. Have them do an individualized approach for you. Definitely want to know, are you in the window of opportunity for starting BHRT to get the best cardiovascular benefit in that 10-year period? And then asking them what types do they use, right? You want to be using transdermal if you have a history of cardiovascular disease. And how will they monitor your levels and adjust the dosages? Like, make sure they are well versed in hormone therapy.
And any blood work?
Yes, you can draw blood work for hormones. There's salivary testing, there's dried urine testing. So there's many different ways to look at hormone therapy, but a blood test is a great place to start. And then you also want to talk to them about what does the role of your diet and exercise play in BHRT.
Love that. Great way to end. Thank you so much, Nurse Practitioner Deidre, for being here. If you want more great information on this and other topics related to your health, you can follow Nurse Practitioner Deidre on YouTube at youtube.com/ at the little @ sign NP Deidre, Deidre.